Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Chidambaram, and I'm very happy to see you all again. I hope you've all been well and in the best of health and spirits. The first step to conquering any disease or health condition would be to understand it thoroughly. However, this is not always easy as medicine is a complex subject and there is enough misinformation out there on social media that can confuse and mislead you. I'm so happy that you have joined Apollo Hospital's FB Live session today, where we aim to simplify and demystify health for you so that you can be armed with authentic knowledge and ready to tackle any health issue without stress. When children fall ill, the family, especially the parents, are very panicked and understandably extremely worried. Again, it is awareness and the right awareness that can help you to handle your child's illness calmly and effectively. So, today we are going to address one such health issue that could affect children stroke and the role of infections in triggering strokes. A stroke is sometimes called a brain attack. It happens when blood flow to the brain is disturbed. And many of us actually think that strokes can only happen in adults and that to older adults. But children can have strokes too, though they're less common. And they can happen at any age, even within the first month after birth, during delivery, right after delivery, maybe when the baby doesn't get enough oxygen when traveling through the birth canal in delivery. It can also affect older kids. Infections can be one factor that can trigger a stroke. So, to help parents understand this issue, to understand the risk factors, be alert, and also take proactive steps, we present the topic infection and stroke in children today. And addressing us today is none other than Dr. Pushpendranath Ranjan, who is the Senior Consultant Neurologist in Stroke and Academic Advisor for the Institute of Neurosciences at Apollo Hospitals, Indraprastha Apollo Hospitals, New Delhi. Dr. Ranjan is also India Past President, Delhi Neurological Association, EC member, European Stroke Organization from 2015 to 18, and on the editorial board of Cerebrovascular Disease. He graduated from the Gandhi Medical College, Osmania University, Hyderabad, and did his DM Neurology from NIMHANS, Bangalore. Dr. Ranjan is a fellow of the Royal College of Physicians and Surgeons of Glasgow, Edinburgh, Ireland, and London, and is a fellow of the American Academy of Neurology and an elected member of the National Academy of Medical Sciences. He has been delivering scientific lectures all over the country and has published more than 100 scientific papers in international and national journals of repute and also written chapters in textbooks. His special interest is stroke and vascular neurology, and we are very honored and delighted to welcome him here today for our FB Live session. And I look forward to hearing from you, Dr. Ranjan, all about stroke and children. And I'm sure, dear viewers, that you're also looking forward to hearing his valuable. Hello, Doctor. Over to you.
Namaste. Thank you very much for an absolutely extraordinary introduction. I don't know whether I deserve all this,
Oh,
but the topic for today seems to be very interesting. We're talking about acute ischemic stroke in children. The first thing we would like to stress is that a stroke in children differs totally from a stroke in the adult. In the adult, you have an aging process which is called atherosclerosis. Atherosclerosis does not occur in children and hence does not cause stroke. As rightly said, the childhood infections form the most important cause of stroke in children. The risk factors in children are markedly different from the atherosclerotic risk factors in adults. Acute systemic illnesses like viral illness, tuberculosis, and an entity called arteriopathy which would mean involvement of the arteries, are the two leading cause of risk factors of the categories which are identified. A large proportion of children with acute stroke have another medical diagnosis that predisposes them to have a stroke. We have an entity called sickle cell anemia. Children who have congenital heart disease, general systemic illnesses, and importantly, a range of genetic disorders. Specific subtypes of arteriopathy associated with childhood stroke is an entity called Moya-Moya disease, where there is an occlusion of the artery of the brain. The other important specific subtype of arteriopathy is an arterial dissection, which would mean an injury to the vessel, and importantly, post chickenpox, post varicella arteriopathies. Large number of infectious agents cross through, as I just said, varicella zoster virus, herpes virus, influenza virus, and many more of them. In our country, childhood TB and stroke seems to be still a very important cause of a stroke in a child. A large proportion of children with tubercular meningitis present with stroke at admission. For those with no evidence of stroke at admission, a quarter develop a stroke by 1 month, suggesting that this could be a brief window period there could be to give us preventive therapy. So, as the causes of stroke differs in children, the outlook of treatment differs, and also the treatment parameters differ than from an adult.
Uh, what age groups do these strokes are? I mean, what age groups are likely to be affected, doctor?
Well, any age group. We have recently had a 3 years old child who had a dense paralysis on one side. And obviously, on detailed examination, it turned out to be tuberculosis. So you could have a stroke in a child of 6 years, 7 years, 8 years, 9 years. So whatever falls in this category is a stroke in the young, a stroke in a child.
Um, Also, what does it, like also occur before the baby is born? Like, can it occur in utero?
Well, certainly the causes of a stroke in utero will be different. These causes in the utero will be more genetic causes of stroke, not acquired causes. Acquired causes means viral infection, bacterial infection. The child is born with the stroke. So there it will be more of a congenital causes of stroke rather than the acquired causes of stroke.
So, what are these congenital causes, and can they be predicted and avoided before the pregnancy, or are there any particular
Well,
tests
that's a very, very
that should
interesting
be?
question that you have a baby who comes out and has a hemiplegia on one side. Usually, one has to think of certain congenital abnormalities in the brain. You could also think of a condition called hydrocephalus, that the ventricles of the brain are enlarged, and importantly, certain vascular malformations of the veins in the artery. And importantly, I've seen one or two cases of what is called a vein of Gallen malformation, where the child is born with a stroke or child is born with the paralysis on one side.
Um, So, as I was saying, is there some way in which these conditions can be, that is, at least in pregnancy, are there any vaccines or are there any genetic tests that an
Well,
expecting take?
see
What should they know about this?
yeah, actually, a lot of these conditions can be picked up in utero, especially while doing regular ultrasonography, which will definitely tell you whether there is ventricular dilatation. Two, it will also help to pick up large venous or arterial malformations.
Um, So we were talking about infections, and you did mention quite a few of the infections like tuberculosis or the herpes or varicella zoster. But the virus in the news today is COVID-19. So does this cause any such infections in children that can precipitate a stroke?
Well, see, the point is that viral infections are post-viral stroke is a very not a very uncommon thing. And in our country, more than that, I think tuberculosis seems to be
The
a
common.
very, very important cause of. If I have a child who presents with stroke, I should look for tuberculosis. If he has tuberculosis, I should look for a stroke. It's both ways.
So, could we talk a little more about tuberculosis since you've said that this is the commonest cause for these childhood infections that precipitate the stroke?
See,
What are the ways in which this can be detected by the parents early? What are the symptoms, and um, uh, what is the incidence of this despite our universal BCG vaccine at birth?
well, tuberculosis usually we all know tubercular infection is a droplet infection. So the child has to have infection from a person who's already infected. That's number one. Number two is that the child may have acquired the infection and you get small tubercles in the choroid plexus in the brain, and it is after couple of months or years these tubercles they burst. If they burst, you may not have had tuberculosis, obvious tuberculosis, but when these tubercles burst, they produce a frank tubercular meningitis. Now, when should the suspicion of tuberculosis come? After all, tuberculosis is a disease which not only causes a stroke, it causes also arteritis or arteriopathy, which I just said.
Yes.
It also causes involvement of multiple cranial nerves of the brain. So, tuberculosis of the brain or tuberculosis of the central nervous system has a huge spectrum, and it is in children who are immunocompromised who usually get these infections, and people who are more immunocompromised, more severe is the infection. A child presenting with fever of unknown origin, which we use the word pyrexia of unknown origin, a child having headaches, a child having weakness in his eyes, a child having paralysis with a contact with tuberculosis, do suspect tuberculosis because tuberculosis is a treatable disorder. If you treat it properly, you can have a normal child back. So it is very important to think of in a child of tuberculosis, and you can only diagnose tuberculosis by an MRI scan. More than that, you got to do a CSF examination.
So, we will now look at a few questions that are coming in from our viewers. Can a fungal infection cause a stroke in children?
Yeah, absolutely. I did not purposely see any. infection, whether it is fungal, whether it is tuberculosis, whether it is cysticercosis, whether it is virus, it's the same mechanism can cause a stroke. The fungus also presents like a meningitis. So if you have a child who has chronic symptoms going on, he has a chronic meningitis, which means the meningitis is going on for some time. Fungal infection comes in the differential diagnosis of any chronic meningitis, be it a child, be it an adult. But I suppose the fungal infections in children would be much lesser than bacterial or viral.
What about the next question is about the urinary tract infections, which are quite common in children. So, can those kind of infections or even a common cold, can they trigger a stroke?
See, the point is that if there's a urinary tract infection or a common cold infection, only thing the way is that if there is an associated involvement of the brain, if you have a viral infection, say for example, this viral infection starts as a UTI, urinary tract infection, or starts as an ordinary viral infection. We don't know what virus it is. And we also know that viral meningoencephalitis, which means involvement of the brain and the meninges, also can present with the stroke picture.
What should parents do to look out and what would be the early symptoms of stroke in children?
See, the lookout is a child sometimes, of course, won't complain. The child we just saw recently, it was the parents noticed that his face was deviated to one side. So the symptoms are the same. If you find a facial deviation, if you find slurred speech, if you find an arm drift, think of a stroke. As I always say, we use the word fast, FAST,
The same
face,
applies.
arm, speech, done for treatment. It'll be the same for any child, obviously, because the poor child may not be able to complain about what exactly is happening to him or her.
And what would be the because we say in for adult stroke that there is the golden time in which they must take treatment, and so here the pathology, the pathophysiology is slightly different. So is that also applicable to children that they must immediately be taken to the hospital, and what
I
kind of
think
emergency
it's a
treatment is given
very
to them?
relevant and a very good question. I'm sure why you asked this question is that the acute thrombolytic therapy is not
Yes,
given in children.
yes.
So we don't use it below the age of 18 years. So that question is out. But that doesn't mean that stroke is not an emergency in children. It is still an emergency. So whether it is an adult, whether it's a 10 years old child, a stroke is a stroke. Maybe you don't do thrombolytic therapy. Obviously, you investigate it immediately and start treating. Because suppose it is a viral meningoencephalitis or it's a tubercular meningitis, the early you diagnose, better would be the outcome. So it remains the same. Stroke is an emergency. Whether it is a child, whether it is an adult. Please don't waste your time. I always say treatment delayed is treatment denied.
Yes. So that's a very important point that parents must be alert and seek medical care at the earliest for if these signs manifest in their children. But are there any ways of actually preventing these strokes, perhaps by immunizations to prevent the infections or other factors?
Well, yes, uh, prevention would really mean do these. For example, we have herpes simplex encephalitis, which also presents like a stroke. I don't know, and I don't think that vaccines really prevent a stroke. But obviously, maybe it increases the immunity of the individual, but it not one to one prevents a stroke. So what it is we have to improve. If a child has a viral infection, treat him, and most importantly, look after tuberculosis, which of course is quite a lot of decline in our country.
And what would be the complications of the stroke, doctor?
See, the complications of stroke are many. One, if it's a major stroke, you leave the child hemiplegic. Two, it will affect the learning, it will affect the memory functions, it will affect the speech, it can cause epileptic seizures, it can cause difficulty in walking. So, all these are the leftovers of stroke. And our aim and our intention always is to prevent a stroke, treat a stroke, and decrease the morbidity of a stroke so that the person goes back to normal activities of daily living.
So for children also, are there like what is the treatment for stroke, and as an adults, is there a post-stroke rehabilitation
Well,
program?
it's a very interesting question. I'm sure why you asked this question, the viewers would like to know.
Yes.
For example, do we use aspirin in children? Ecosprin is the backbone of treatment of prevention in adults. Now, when we looked up the literature this time when we had this child, there is now a role of even giving aspirin in children. And the patient we treated recently, we looked up the literature and it is clearly mentioned that these children should be put on low molecular weight heparins for 6 weeks, and then they should be given aspirin for 2 years for stroke prevention, which would be very different than an adult in the sense an adult would receive aspirin for the rest of his life. An adult would require statins for the rest of the life. But the child, stroke in the young, does not require statins, he requires aspirin for 2 years. That is what is the latest recommendation.
And what about the post-stroke? Are there any rehabilitative therapies which are used in
Well,
children?
yes, excellent. And I usually believe in early rehabilitation. Once the neurological deficit you think has got fixed, the physiotherapy rehabilitation should start on the spot. It may be passive for the first few days, then as it becomes active. So I think rehabilitation is an important part of stroke treatment. And I firmly believe early rehabilitation is the answer for children and adults to make a good clinical recovery.
But can it be done even in very young children who, like for example, if they're below 1 year, so would
Well,
they
yes, I
be
think
some?
I understand what you're saying, but I think they may not be very cooperative with you. That's why I said they would require more of passive. See, at least even if you do passive physiotherapy, you can save the child for getting contractures. If you can't do active physiotherapy in a conscious adult or little older child.
And what is the final question is what is the possibility of complete recovery? And does it really depend on early treatment or does it depend on the severity? So what determines the prognosis?
Excellent recovery. I would say, in my own experience, though I treat a lot of strokes, I treat predominantly strokes even in children. By and large, the recovery depends on the cause. But we must remember one thing because it is the child's brain, the collaterals in the brain are so good that they start recovering quite fast. The last patient, again I repeat, now it's about 6 weeks, he's recovered nearly 100%. So one should give them a good prognosis that these guys are going to recover well.
Absolutely. So, thank you, Dr. Ranjan, for this very illuminating discussion on stroke in the young. And I think it really enlightened us because it is definitely a confusing topic because one doesn't associate stroke and young children and infants, but you have clarified all these questions extremely clearly for our viewers. Thank you, viewers, also for joining us today. And if you have any further questions or comments, you know that you can always put those on the Facebook page, or you can inbox us in the messages section, or you can subscribe to our YouTube channel for the latest information on trending healthcare topics. See you all soon again next week. And meanwhile, as India enters the festive season, celebrate safely, eat wisely, and enjoy the festivities with your loved ones. Thank you
Thank you.
and namaste.
Thank you.